Hello, class. So, for this week's pathology, I chose to do mine on a disease called glaucoma, which is a disease of the eye. So, what is glaucoma? So, glaucoma is a disease that damages the optic nerve in the eye, and it usually creates high pressure inside of the eye. So, as you can see in this image right here, it creates a lot of pressure on the inside of the eye. It can lead to vision loss or blindness if it goes untreated for a certain period of time. So if you are showing these symptoms, you should go get checked out immediately so you don't develop blindness or vision loss from that. It's often called the silent thief of sight, and it's called this because sometimes people wouldn't even know that they had the disease, but then they start developing symptoms out of nowhere. So that's why it's called that. So here's some causes and risk factors of this disease. So you develop a buildup of fluid inside the eye. So as you can see, this person, their eye is inflamed, and that's because they have a lot of fluid in there. It also increases pressure as a result. Some risk factors of this are old age. So like older adults usually develop this disease, or like older people. Family history is another one. So it's definitely hereditary, like most of the diseases and the pathologies that I've covered, or in general. And diabetes, actually, surprisingly, I didn't know that diabetes was one of the major risk factors, but diabetes can actually, in turn, help you develop this disease, and that's not good. And then another one, surprisingly, high blood pressure, and it can develop slowly without symptoms, so you wouldn't know that you had the disease until you're starting to experience vision loss and your eye becomes inflamed. So here's some symptoms. So for the early stages, there's no noticeable symptoms at all. So you wouldn't even know that what was supposed to come next or what's to come next. In some later stages, that's when you start to experience blurry vision, and then you lose loss of peripheral vision, which is like your side vision. So like right here, this image shows it well because that's kind of like from your point of view if you were to lose your peripheral vision, so you couldn't see like from either side of you. If you're staring straight, you know how like you could see um, most of the room. Well, you wouldn't be able to anymore after developing glaucoma. And then eye pain in some severe cases. So that's like when you didn't go to the doctor and you left the disease untreated. That's where you develop eye pain. And also the damage is permanent. So here's some treatment and prevention for glaucoma. So actually, there's no cure, but it can be managed. So just make sure to keep some eye drops around. There's also medication for that too, and surgery in some cases where it's really severe. Prevention is Prevention steps you can take are to have regular eye exams. So just schedule some regular eye exams with your eye doctor, and just make sure to catch the signs early on before it gets too severe. And here's a reference that I used.